Good day, everyone. Mm, I'll start my lecture. Today, we are going to discuss about the principles of safeguarding in health and social work. And today, we are going to discuss about the learning outcome 3, which is understand the policy context of safeguarding. So, today, we are going to discuss about the policy context of safeguarding in health and social care. So, if we ask, um, why understanding the policy context is important in safeguarding. So the answer could be it helps ensure that care practices are legally compliant and ethically sound. And if we have a question like what a safeguarding policy generally includes, so we can say that a safeguarding policy includes guidelines on how to protect vulnerable groups, then reporting procedures and responsibilities of care providers in the or the anyone in the field of health or social care, and even like it's our duty to promote well-being of everyone and to safeguard everyone, no matter which place of work we are working. And now, how does the policy environment influence everyday decision in a care setting? So what it does, it shapes decision by setting standards and protocols that care workers must follow to ensure safety and well-being of service users. Then, uh, if we say that role of local authorities in safeguarding policy framework, what would be the role of local authorities in safeguarding policy framework? So, local authorities coordinate safeguarding strategies, provide training, and ensure compliance with national laws. So, we are discussing it with the United Kingdom context. And then, uh, if we ask why it is important for a care worker to stay updated with changes in safeguarding policies, what it does, it ensures the practices are current and provide the best protection based on the latest legal and ethical standards. So, mm, in general, staying updated is indeed crucial for everyone, and it's crucial for effective safeguarding. And we will uh, discuss further. So this was the brief discussion about today's topic. Now we will move to the next slide. Okay. So in the next slide, we have key terminology and what is the policy of safeguarding, what is the context of safeguard, what is an example of safeguarding policy. So it says that what is safeguarding policy statement? A safeguarding or child protection policy statement makes it clear what your organization or group will do to keep children safe. It should set out your organization commitment to protecting all children, and contextual safeguarding recognizes the impact of public social context on young people's life and consequently their safety. Contextual safeguarding seeks to identify and respond to harm and abuse posed to young people outside their home, either from adults or other young people. And they have given us an example. of safeguarding policy, recruiting the right people to work and volunteer with children, preventing and responding to bullying, responding to concerns about online abuse, ensuring photographs and images of children are taken, stored, and shared appropriately. So, what we are going to do is we are going to clarify some important terminologies associated with safeguarding. So, we'll start with the policy of safeguarding. So, this refers to the overall approach and regulations an organization adopts to ensure um, uh, and like approach and regulation adopts to ensure the safety and well-being of individuals, particularly vulnerable groups like children or the elderly. These policies are crucial as they dictate how potential risks are managed and addressed within care setting. And if we say that, uh, think of why such a policy is crucial in any care environment. So it helps ensure everyone knows how to act in situations where someone might be at risk, ensuring consistent and effective protection. Now, the next uh, point is safeguarding policy statement. So it is a more specific document. It clearly outlines an organization's commitment to protect all children and what action it will take to ensure their safety. This statement is key for transparency and accountability, letting everyone involved, staff, parents, and the community, uh, and like know exactly what the organization standard for and how it plans to act on its safeguarding duties. And if we talk about an example of what might be included in this statement, it might include the organization's commitment to regular training for staff on safeguarding practices. Now, let's discuss contextual safeguarding. This is a relatively newer concept that expands the understanding of risk beyond the family environment. It acknowledges that young people's social environment, like school, neighborhood, or online spaces, can pose significant risk of harm. Contextual safeguarding therefore involves strategies to protect youths from risks identified in these broader social contexts. Now, if I ask, why do you think this broader perspective is important? So, what it does, it helps in identifying and mitigating risks that aren't immediately obvious within the home but are prevalent in other social settings where children spend a lot of time. Then, lastly, an example of what might be included in a safeguarding policy. It could be procedures for recruiting staff and volunteers. This includes conducting background checks to ensure that those who are working with vulnerable groups are suitable and pose no risk themselves. It also encompasses measures like how to handle and report bullying or online abuse and guidelines on how photographs and images of children should be managed. And the benefit of having these detailed policies, these policies help create a safe and structured environment where everyone knows their roles and responsibilities in safeguarding, reducing the chances of abuse. Understanding these terms and how they apply within your work setting is foundational to effective safeguarding practices. So this is all about this slide. Then we have the next slide. What is safeguarding policy in the UK? Offset, offset safeguarding policy. Okay, so what they're saying, protecting the rights of adults to live in safety, free from abuse and neglect, people and organizations working together to prevent and stop both the risk and experiences of abuse or neglect. And regarding the offset safeguarding policy, uh, safeguarding vulnerable adults is defined in the Care and Support Statutory Guidance issued under the CARE Act 2014 as. Okay, so we have some bullet points regarding it. Safeguarding, protecting the rights of adults to live in safety, free from abuse and neglect, people and organizations working together to prevent and stop both the risk and experience of abuse or neglect. People and organizations making sure that the adults' well-being is promoted, including where appropriate, taking fully into account their views, wishes, feelings, and beliefs in deciding any action, recognizing that adults sometimes have complex interpersonal relationships and may be ambivalent, unclear, or unrealistic about their personal circumstances and therefore potential risk to their safety or well-being. Okay, so we are going to explore the specifics of safeguarding policy in the UK along with an in-depth look at the offset safeguarding policy. So we'll start with the broader safeguarding policy in the UK. This policy is designed to protect the rights of adults, ensuring they live in safety, free from abuse and neglect. It encompasses a collaborative effort among individuals and organizations to prevent and respond to abuse and neglect. So, if we share why collaboration among various organizations might be critical in safeguarding. So, collaboration ensures that information and resources are shared, which can lead to more effective protection strategies and quicker responses to issues. Collaboration is the key to creating a robust network of support and intervention. Now, moving on to the offset regulation policy, which is specific to education and care settings. According to the Care and Support Statutory Guidance under the CARE Act 2014, safeguarding vulnerable adults include not only protection from harm but also the promotion of well-being. It emphasizes the importance of considering the individual views, wishes, feelings, and beliefs in decision-making processes. So, the importance of including the adult perspective in safeguarding decision is it respects their autonomy and ensures that any action taken are more tailored to their specific needs and circumstances. Respecting the individual needs is crucial, especially when they might have complex interpersonal relationships or any feelings about their own circumstances. This complexity makes it necessary to have approach, a different approach for each case. Lastly, the policy also highlights the need for organizations to work together to mitigate risk and promote safety and well-being. So, why we think the policy stresses the importance of considering potential risk to safety or well-being? Because understanding and mitigating risk can prevent harm before it occurs, leading to better outcome for the individuals involved. Proactive measures are fundamental in safeguarding to ensure the vulnerable individuals are not only protected from harm but also have their well-being actively promoted. So now this is all about this slide, and we have this video to watch. Right, so that was the video. We'll move to the next slide. Why is safeguarding so important in healthcare? Okay, there's another video to watch. Okay, this was about uh, safeguarding in healthcare. So now this is the next slide. So what it is about, identify the legislation, policy, and guidelines relating to safeguarding. And to protect the individual from abuse, it is useful to have an awareness of UK law, policies, and procedure, as well as local systems that relate to the safeguarding of adults. Right, okay, so we have legislation, policy, guideline, and its description. For example, we have Children Act 1989, Children Act 2004, Working Together to Safeguarding Children 2018, CARE Act 2014, Mental Capacity Act 2005, Human Rights Act 1998, Safeguarding Vulnerable Group Act 2006, and Information Sharing Advice for Practitioners 2018. Right. Okay. So we are going to explore some critical legislation, policies, and guidelines that form the backbone of safeguarding practices in the UK. Understanding these is crucial for anyone working in health and social care. So let's start with Children Act 1989. This act primarily outlines the responsibilities of local authorities and other agencies in protecting the welfare of children. It includes provisions like establishment of child protection services and appointing a designated safeguarding lead in schools. Why is having a designated safeguarding lead important in school? Because it ensures there is a clear responsible person who understands the safeguarding policies and is equipped to handle related issues. So now next move to the Children Act. Let's move to the Children Act 2004. Children Act 2004 builds on the 1989 Act by introducing the duty for local authorities and their partners to cooperate in promoting the welfare of children and young people. It also established local safeguarding children boards and what is, for example, role of local children board. So they coordinate and monitor local safeguarding arrangements to ensure they are effectively and that the agencies collaborate properly. So these are the important things in that. Um, Now we have Working Together to Safeguard Children 2018. So this is a piece of government guidance that details the roles and responsibilities of various agencies involved in safeguarding children. It emphasizes the principles of effective safeguarding practices. Now, why clear role and responsibilities are crucial. So, they help prevent confusion and ensure that all parties know their specific duties, which can lead to more timely and effective interventions. Now, let's discuss the CARE Act 2014, which is similar to the Children Act but focuses on adult. It outlines the duties of local authorities to protect adult at risk of abuse or neglect and establishes safeguarding adult board and what might be the significance of these board. Safeguarding adult board ensure that safeguarding practices are carried out effectively across different organizations and that adults' welfare is a priority. So now move to Mental Capacity Act 2005. It provides a framework for making decisions on behalf of adults who lack the capacity to make decisions for themselves. It includes protection against abuse. Capacity is important in safeguarding because it ensures that vulnerable adults who cannot make decisions for themselves are protected and that any decision made on their behalf are in their best interest. Now, the next one is the Human Rights Act 1998 incorporates the European Convention of Human Rights into UK law, protecting rights like privacy and prohibiting inhuman treatment. It relates to safeguarding because it ensures that individual rights are respected in all actions taken in safeguarding context, protecting them from abuse and neglect. Lastly, the Safeguarding Vulnerable Group Act 2006. Um, okay, so it establishes the disclosure and bearing services which help employees check if individuals are suitable to work with vulnerable group, coupled with the information sharing advice for practitioners 2018, which guides how to share information legally and ethically. These laws form a comprehensive safeguarding framework. How does proper information sharing impact safeguarding? It allows for better coordination and informed decision making, ensure that all relevant facts are considered when protecting someone. So these laws and guidelines are essential for protecting individuals and ensuring their rights are respected. So we have to make sure that we are familiar with them as they will guide our action in professional settings. So now moving on to the next slide. So the next slide is legislation. The primary legislation laws that protect adults from abuse are okay. So here they are discussing about the Equality Act 2010, the Human Rights Act 1998, the Care Act, Health and Social Care Act 2012, Mental Capacity Act 2005, Mental Health Act 1983, Data Protection Act 2018, including GDPR, Safeguarding Vulnerable Group Act 2006, Modern Slavery Act 2015, Female Genital Mutilation FGM Act 2003. Okay, so we have discussed most of these legislation and laws in our previous lectures as well. So we will discuss the primary legislation that protect um, adults from abuse in the UK again. And these laws provide a framework for safeguarding practices, ensuring safety and promoting the well-being of vulnerable groups. Let's begin with the Equality Act 2010. This law protects individuals from discrimination, which can often manifest as discriminatory abuse. How or how the discriminatory abuse look like? So a discriminatory abuse could involve harassment or denial of services based on an individual race, disability, gender, or sexual orientation. Now, Human Rights Act 1998 establishes fundamental rights and freedoms such as the right to liberty and security and freedom from slavery and forced labor. This act underpins all safeguarding actions by ensuring they respect the They respect these basic rights. Now, moving on to the CARE Act 2014, is a cornerstone in adult safeguarding. It made local authorities responsible for investigating suspicious or allegations of abuse, established multidisciplinary safeguarding adult board, and identified 10 types of abuse. So, what are the types? What is the significance of having multidisciplinary safeguarding adult boards? They ensure that different professionals work together to review cases comprehensively and respond effectively to safeguarding incidents. Now, the next is Health and Social Care Act 2012 set up health and well-being boards and clinical commissioning groups (CCGs), emphasizing the necessity for agencies to collaborate in protecting individuals from abuse. Collaboration is vital for creating a cohesive safeguarding strategy, and it's updated, I believe, in 2022 Health and Care Act. So I always like encourage my students to check for the latest version of the law as well. But like if we have a context where we need to discuss about the old policy or the law or the legislation, that's also fine. But we can like add a line into our uh, written work, or if we are explaining it, we can explain it that we are referring to the Health and Social Care Act 2012 in this context. An updated version is also available, like the Health and Care Act 2022. So we can write something like that to make our point clear. So now the Mental Capacity Act 2005, on the other hand, it protects individuals who cannot make certain decisions for themselves. So why is protecting these individuals crucial? Because they might not be able to recognize abuse or advocate for themselves, making them particularly vulnerable to exploitation and harm. The Mental Health Act 1983. It focuses on the rights of individuals with mental health needs. And if we talk about the Data Protection Act 2018, including GDPR, helps safeguard personal data, reducing abuse linked to data mishandling. Additionally, the Safeguarding Vulnerable Group Act 2006 ensures that those in direct contact with vulnerable groups like care workers are properly vetted. This vetting is done through the disclosure and bearing services. So whenever we apply for a job in health or social care setting, we always have to provide the disclosure and bearing services. So especially in health and social care, we have the enhanced DBS. Uh, Generally, people have like the normal DBS, but especially in health and social care, we always do the enhanced DBS check. Okay, so and we also have specific legislations like the Modern Slavery Act 2015 and the Female Genital Mutilation Act 2003. So what these do, uh, they tackle severe form of abuse, including human trafficking and female genital mutilation. Each of these laws address different aspects of abuse and safeguarding, reflecting the complex and multifaceted nature of this field. It's crucial for everyone in health and social care to understand these laws to effectively protect and advocate for vulnerable individuals. Right. So this is about this slide. Now, the next slide, we have national policies. National policy also has a role to play in safeguarding vulnerable adults. Such policies include Mental Capacity Act, Code of Practice, deprivation of liberty safeguard, and professional registration bodies, Care Quality Commission, CQC, making safeguarding personal local government association. Okay, we also have a link here, so you can go to that link and read about the code of conduct for healthcare support workers and adult social care workers in England. So students, please do make sure that you check this link as well. Okay, and so we will uh, talking about the national policies that play a crucial role in safeguarding vulnerable adults. These policies not only guide our practices but also ensure a standardized approach across various services. So we'll start with the Mental Capacity Act Code of Practice. This document provides detailed guidelines on how to implement the Mental Capacity Act 2005. It's designed to promote the rights of individuals who might lack the capacity to make certain decisions for themselves. And uh, what it does, it ensures that decisions made on behalf of those who lack capacity are done with their best interest in mind and that their rights are always considered. So, next we have the deprivation of liberty standards. So, which amends the Mental Capacity Act to make it lawful to use uh, restraint or restrictions only if it's in the individual's best interest. This safeguard is crucial in preventing the misuse of restraint and what might be the potential risk if such safeguards were not in place. So without these safeguards, individual could be unnecessarily or inappropriately restrained, leading to abuse or neglect. And moving on to workforce guidance, the Code of Conduct for Healthcare Support Workers and Other Social Care Workers in England outlines best practices and ethical standards for care workers. Why is having a specific code of conduct important for social or care workers? Because it sets clear expectation and standards for behavior, which helps maintain high quality care and protects both the workers and those they care for. Now, professional registration bodies, for example, for doctors, nurses, social workers, and other professionals, these bodies regulate standards and practices within their profession. And why it impacts the safeguarding? Because it ensures professionals are qualified and adhere to ethical guidelines, reducing the likelihood of malpractice and enhancing the safety of vulnerable adults. Now, the Care Quality Commission. Uh, the Care Quality Commission, CQC, plays a significant role. It's the government agency tasked with regulating, inspecting, and rating all providers of care. The CQC ensures that care providers meet fundamental standards of safety and quality. The role of CQC is critical because the CQC inspections and regulations help ensure that care services are not only adequate but also safe and respectful for the rights of those receiving care. Now, making safeguarding personal is an initiative by the local government association aimed at developing an outcome-based approach to safeguarding. It focuses on the preferences, desired outcomes, and experiences of the people needing support. So, why is an outcome-based approach beneficial in safeguarding? Because it ensures that safeguarding measures are not only effective but also align with the individual needs and circumstances, leading to more personalized care. These policies are integral to ensure that safeguarding practices not only comply with legal standards but also respect and prioritize the needs of individual. So this is about it. Now we'll move to the next slide. Local systems, the principles of safeguarding at a national level drip down into local systems that are on the front line in the prevention of abuse towards vulnerable adults. Some of the local systems include local authorities, safeguarding adult board, local constabulary, agreed ways of working. Right, okay. So we will explore how the principles of safeguarding at the national level translate into effective local systems that directly address the prevention of abuse towards vulnerable adults. So let's start with local authorities. Local authorities play a vital role in safeguarding by making inquiries when there are suspicious or allegations of abuse. It is crucial for local authorities to take the lead in these investigations because they have the jurisdiction and resources to coordinate a comprehensive response and ensure that the appropriate actions are taken to protect individuals. Local authorities have the necessary infrastructure and authority. Next, we have the safeguarding adult boards. These are multi-agency teams uh, led by local authorities that oversee safeguarding in their regions. They also conduct safeguarding adult reviews when individuals die as a result of abuse to determine prevention strategies. What's the importance of having a multi-agency team like the safeguarding adult boards? It brings together different perspectives and resources, ensuring a more thorough and collaborative approach to safeguarding and investigation. Now, moving on to the local constabulary, also plays a vital role in safeguarding. They uphold the law and investigate criminal acts related to abuse. Why is the involvement of law enforcement is critical in safeguarding scenarios? Because they have the authority to enforce the law, conduct criminal investigation, and take legal action, which is essential for dealing with cases that involve criminal abuse. Their role is very important for ensuring justice. And um, now, lastly, we have uh, agreed ways of working. So, which includes robust policies and procedures that all health and social care providers should implement to protect individuals from abuse. This includes safeguarding policies, whistleblowing policies, and many others. These standard policies and procedures are necessary because they provide a clear framework for action, ensuring consistency in how safeguarding issues are handled across different settings, which improves the overall effectiveness of safeguarding measures. Consistency and clarity are essential for effective safeguarding. Each of these local systems plays a crucial role in the overall safeguarding framework, ensuring that the principles established at the national level are effectively implemented on the ground to protect vulnerable adults. So now we'll move to the next slide. In the next slide, we have evaluate the impact of key requirements on safeguarding. So we have duty to report, multi-agency working, right. So we will evaluate how specific key requirements have significantly impacted safeguarding practices. So we'll start with the duty to report. The legal duty compels practitioners and agencies to report any suspected or actual abuse or neglect of vulnerable individuals. The duty to report has ensured that concerns are not overlooked. It prompts immediate action, which is crucial for preventing further harm and protecting vulnerable individuals. The promptness of these actions can be life-saving. It establishes a culture of vigilance and responsibility among professionals. Now, let's discuss multi-agency working. This approach involves various professional and agencies like healthcare, social services, and the police working under structures like local safeguarding children boards and safeguarding adult boards. Why the collaboration is important? Because it allows for a more comprehensive understanding of the individual situation, pooling expertise from different fields to ensure a well-rounded response to safeguarding issues. The diverse perspective and resources that each agency brings can lead to more effective identification, investigation, and intervention in case of abuse or neglect. This collaboration also facilitates better communication and strategy alignment, which are crucial for safeguarding cohesive safeguarding efforts. So now considering these impact, what might be some challenges that associated with these requirements? Challenges could include different priorities among agencies, potential delays in communication, and the complexity of coordinating responses across multiple organizations. Those like addressing these challenges requires ongoing training, clear protocols, and a strong commitment to collaboration. It's also essential to continually assess and refine these processes to ensure they remain effective in the face of evolving changes. So, move to the next slide. In the next slide, we need to discuss about safeguarding policies and procedures, training and awareness raising, disclosure and bearing services, DBS check. Right. So we have some requirements. Right. So these requirements have created a solid foundation for protecting vulnerable individuals from abuse and neglect. They have established clear legal and policy frameworks, promoted effective multi-agency collaboration, and heightened training and awareness across various sectors. So why it is important that a clear legal framework is crucial for safeguarding? What it does, it provides a standardized approach to handling cases, ensuring that all actions are legally defensible and ethically sound. This helps maintain high standard across all agencies involved in the safeguarding. These frameworks not only guide professions in their duties, but also offer protection to the vulnerable by ensuring consistent practice. Multi-agency working has been a game changer by allowing different professions to bring their expertise together, enhancing the effectiveness of safeguarding measures. And there are some benefits of this enhanced collaboration. Uh, for example, it prevents gaps in service delivery and ensure a more comprehensive assessment and response to safeguarding concerns, which can lead to better outcomes for those at risk. Additionally, the emphasis on training and raising awareness has been vital. This not only increases the ability of professionals to recognize and respond to abuse, but also empowers communities to act as watchdogs. Now, considering the continuous evolution of societal norms and technologies, why it is important to keep evaluating and refining our safeguarding practices, because new types of risk and abuse scenarios emerges as societies and technologies evolve, and our safeguarding practices must adopt to remain effective in protecting the vulnerable. Ongoing evaluation and refinement are essential. It ensures that our practices do not become outdated and continue to effectively address the current needs of vulnerable individuals and communities. Right. So what we have next. Okay. In the next slide, the key requirements of safeguarding have profoundly and positively impacted the protection of vulnerable individuals from abuse and neglect. By establishing robust legal and policy framework, these requirements have provided a structured and standardized approach to safeguarding across various sectors. The promotion of multi-agency collaboration has enhanced the comprehensiveness and effectiveness of responses to safeguarding concerns, utilizing the strength and expertise of different professionals to ensure a holistic approach to protection. The emphasis on training and awareness raising has significantly increased the capacity of professionals and communities to identify and respond to potential risks. This proactive approach not only mitigates harm but also fosters a culture of vigilance and responsibility. The landscape of risk and societal context is ever evolving, presenting new challenges that require our safeguarding practices to be dynamic and adaptable. Therefore, ongoing evaluation and refinement of these practices are crucial to ensure they remain effective in responding to the challenging needs of vulnerable individuals and communities. This continuous improvement will enable safeguarding systems to not only react to abuse but also anticipate and prevent potential threats, ensuring that protection measures are always aligned with current realities and best practices. So, this was all about today's lesson. And if you have any question, any of the student have any question, they can ask. And the next class would be on the learning outcome 4. So I think we don't have any question. So we'll wrap up today's session then. And I'll see you in the next class. Till then, take care, everyone. Bye.